Well, with more on today's announcement, we're now joined by the Health Minister Mark Holland. Minister, thank you for being here.
Thanks for having me, Michael.
So let's talk about this initiative. Once again, a program that touches on shared jurisdiction between Ottawa and the provinces. Talk to us about the consultation. Just how much of a demand was there? Was there extensive consultation when it came to this program?
Well, I think you got to look. You can't look at it in isolation. We have the agreements that have been signed with every province and every territory on health, and a very significant portion of those agreements, about 30% of them on average, actually deals directly with mental health. And a lot of that is dealing with sort of the system official part of how people would interact with the mental health system and with the health system overall. But we know there's a lot of gaps. There's a lot of people who aren't proactively walking into health settings and getting the support and service they need. And as I've been across the country, and certainly as I've been talking with my provincial and territorial counterparts, aware there's a huge need at a community level. And one of the things that's really remarkable is you have these small little organizations that are running on shoestring budgets that are able to meet young people where they are, that really understand their community and do extraordinary things with small amounts of money. So it's about really supercharging and enabling those community organizations to connect with young people and to really tackle directly some of the mental health challenges that they're facing.
So tackle directly. Do you then envision this money to what? Hire more social workers, hire more therapists, go into infrastructure? Where do you see this money being spent?
Well, it's going to be different in every place. Because what is needed in Ajax is not the same as what's needed in Nanaimo or in Iqaluit. So being able on the ground to work with community organizations and have them define those priorities of exactly what do they need to be able to meet youth where they're at and to be able to tackle the issues in mental health, and ideally as far upstream as we can be. Look, the evidence is very clear. If we can get to young people early and make sure they are surrounded with the right kind of supports, particularly when it comes to mental health, that it means much better outcomes for them, not just in terms of their health, but certainly in terms of public safety and in terms of productivity and the future of their careers. So this is an investment I think is going to pay huge dividends. I would hazard a guess that the money that we're spending here will be made up many times over in reducing negative health outcomes, reducing bad outcomes in terms of public safety, and increasing productivity in the future of these young people.
Now, in the last election, your party did promise to fund mental health programs for post-secondary students. Is that what we're seeing here today, this announcement, a follow-up through on the promise made back in 2021?
A little bit, but it goes beyond that. I think, there was a recognition as we've been going out and negotiating these bilateral agreements that we're doing great things in those bilateral agreements, but there's still a really strong need at a community level for additional supports and to be able to meet youth in non-traditional places and cultural settings and in ways that our traditional health system isn't able to get to them. So this is sort of looking at that commitment that was made in 2021 and going significantly beyond it, because when you look at the quantum of money involved through the bilateral agreements and now the announcement that we've made today, this significantly exceeds what we committed in 2021.
Okay. Can you talk to us a bit about the rollout of funding? When will the money actually start coming out? Will it be across many years? Will it be little by little? Because it has been the example set in the fall fiscal update that really a lot of the programming unveiled most recently is a rollout across several years.
Yeah, I mean, I think you take a look at the bilateral agreements, that $200 billion over the next 10 years, that's money that's flowing now. These agreements you're seeing it reflected in provincial budgets and in detailed plans of exactly how that federal investment is impacting and expanding services and improving outcomes across the country. So that's money that's booked and is moving and happening now. I think on these dollars, what we're going to want to see is plans from these community organizations. As I mentioned to you, Michael, these organizations are incredible at doing near miraculous things with very tiny amounts of money. We want to see their proposals. We want to see their plans. We obviously want to work with provinces and territories to coordinate the efforts here with other things that are being done. But the idea is to flow this money as soon as possible, but also to make sure that it's impactful and that it's going where it needs to go to get the best results.
Now, I also want to talk about dental care while you're here, because as you know, more than 1.5 million Canadians have already signed up for the program's next phase, the expansion. But your ministry reportedly says that the dentists who've actually signed on to provide the care really only number into the thousands when you look at hundreds of thousands that want the service. Will there be a shortage of providers?
Well, we know that there are challenges with providers. We knew that before we began. We are adding 9 million Canadians to the system, and that's not going to be without challenges. But we are extremely confident that we're going to be able to rise to the moment and be able to ensure that everybody does get that care. And so working very actively with provincial and territorial dental associations and direct meetings, one-on-one with providers to make the best system that we possibly can, both easy to use, easy for them to participate. And I would say, because we did anticipate there would be challenges, we also set aside money for an oral health access fund so that we can lean in and really help increase the number of oral health professionals that are there and can find ways of getting to folks, because even when you have enough dentists in rural and remote communities, it can be quite difficult to get to people. So looking at how we might be able to have remote clinics and use hygienists and work in different creative ways and use that oral health access fund to get to people. So we have 9 million Canadians, a quarter of Canadians who don't have oral health care. So through a coordinated approach on a whole bunch of different measures, we're going to ensure that we get everybody covered. That is the biggest federal program in Canadian history. It's not going to happen overnight. We never anticipated that it would be, but we're going to get there.
Will there be a delay in implementation, though, if right now you're still trying to sign on more healthcare providers?
No, we're going in May as anticipated, so the first Canadians will be seen in May. We've been moving through the cohorts, sort of starting with our oldest and most vulnerable and moving through the population. People are signing up at 65 right now. We have 1.8 million Canadians who've signed up. And then similarly, the access to care has different start dates so that we can slowly roll out this care to people in a way that is level and that the system can manage. And so there's a really robust pickup, but we want to see much stronger pickup. That's why I'm continuing to work with the oral health professionals, and be they hygienists or be they denturists or dentists, to make sure that we have ever more people joining to meet that demand as people do come online.
Minister Mark Holland, out of time, but really appreciate the time tonight. Thank you for that.
Thanks so much, Michael.